Care coordination is new to Bethany Children's. It started about 2 years ago, but the departments within care coordination are not new. We have a referrals and admissions team, behavioral health, social services, and patient navigation. These teams all work together to get that patient and family experience from great to excellent.
Our process is kind of the front line of things. We take initial phone calls for referrals. They can be in-state, out-of-state. We get local clinics or rural clinics. We get phone calls from families just wondering if there's a way that we can help their kiddos. And once we get that initial phone call, we gather the information needed to share with our census and referrals team so that we can review that patient and see if there is a way for our team to help in some way.
The social services department is involved throughout the continuum from admission all the way through to the discharge. The social services department stays in continuous contact with the families, making sure that they're staying engaged and involved in their child's care. Once we've identified that a family is up to date on trainings, that the child's medically stable, we start coordinating to set up follow-up appointments, making sure that all the medical equipment's in place, coordinating private duty nursing so that they have assistance in the home once they discharge.
Hi, I'm Jana Wing. I'm the Advocacy Program Manager at Bethany Children's Health Center. We have a group of licensed professionals at Bethany Children's who are dedicated to addressing the mental health needs of our patients and their support system. Our behavioral health team is comprised of a psychologist and licensed clinical social workers. In our huddles, it's a time that our team can get together and debrief the cases that we're working on, solicit new ideas from each other, and just talk about how to incorporate the rest of the interdisciplinary team into caring for the child and enhancing their care, just really helping them maximize the goals that they're working on in therapy and their medical goals.
Each of those nurse navigators has their own respective specialties that they round with. So once they get their specific orders, they take those kids and they get them plugged into their lists. So we have 28 different lists of over 100 kids that we're constantly seeing every week. And so we plug in those new kids where they need to go with what specialties. Then our nurse navigators do all of the prep work for the physicians that are going to come out here. We have 2 patient navigation specialists, and they are responsible for all of those external appointments that go on.
We need all of our teams within the hospital, but especially our case managers and social workers and patient navigation, behavioral health. They need to know the specifics to each of their departments so that we can ensure a smooth transition from an acute care setting to our hospital, to home. The teams in care coordination are amazing. They always hold themselves accountable, they take ownership, and they truly, truly care about the outcome of each patient.